I'm David Brailer. I'm chairman of Health Evolution Partners. We are an investment fund that looks for the best new ideas in the healthcare industry around the world, and we fund them and help them come to the market and become important companies in the future of healthcare. My background is I'm a physician, trained in infectious disease. I have a PhD in economics, and my first job was a professor at the Wharton School of Business. I then became an entrepreneur and built up companies, and then became a federal policymaker, being the senior staffer for President Bush on health IT and health-related issues in the Bush White House. And I started Health Evolution 2 years ago. I think there's really three issues, and this is really not the president. This is the broad set of elected leaders in Washington. First, have a very short cycle. Their attention span is very short, and things like health information technology play out over decades, or at least over many years. So that's a time mismatch that makes it hard to have the conversation about investing public money and getting the kinds of benefits that they'd like to see. Secondly, to accomplish a goal in the marketplace, like having electronic records be in place, one has to first believe that it's the role of government to ensure a result that the market hasn't. And it was never clear to us that the market had failed. The conclusion I came to was that the regulatory environment had failed. It had prevented this from happening. Therefore, the government had an obligation to fix the problem, but an ideal would have been that the market solved it itself. The third challenge really was, how do we deal with all of the broader issues in healthcare that are not about IT? We're going through that in Washington right now. It's hard to isolate one issue out, like electronic records, and pretend like the others don't exist. But I was struck in Washington by how bipartisan, how broad and deep the support was for electronic records. And I think it was clear that it's an idea whose time had come. The inspirational part of our job is that we get to see a cross-section of all the best thinking and the best thinkers in the healthcare industry around the globe. People that are finding solutions, that are looking at problems, that have discovered something, that have created something, that have conceptualized something. And it's very encouraging to see the level of energy and capability and the breadth and depth of innovation and new ideas that are coming forward. It's something that's happening not just in health IT or pharma or biotech. It's happening with new kinds of devices, with human robotics. It's happening with the way we manufacture and distribute products. It's happening the way hospital care is being rendered and the way doctors give treatments. It's broad, and it's happening in many countries. It's very challenging, though, because things that improve the healthcare system often can't find a market because the market is spoiled by payments from insurers and governments that actually pay more for bad quality and pay more for inefficiency. We have very perverse incentives built into our healthcare system, even in Britain, where it has a more aligned, more rational model. And so this is a really difficult challenge. And secondly, it's an industry that is tremendously undercapitalized with respect to what it needs to be able to support its foundations. So change is very difficult and very slow. But in the end, good ideas do come to the fore, and good ideas do change the industry, and that's what we're looking for. I think in the end, healthcare should be a retail marketplace that's run by consumers. That doesn't mean that there's not a role for doctors or nurses or hospitals. It means, though, that in the end, the key decision maker is someone making decisions on their own behalf or for their family, and the finances follow their decisions. The industry follows their decisions. I think right now it's not a patient-centered system. It's not a patient-centered insurance model. It's not a patient-centered care model. It's not a patient-centered prevention model. And I'd like to see that happen. I think the United States is closest to moving towards that, but many countries understand the phenomenon that's playing out. I do like the way some countries have been very good at advancing innovation in IT. Canada, for example. I like the way some countries have advanced innovation in biotech. Korea, for example. But in the end, I think there is no perfect system because we're still dealing with yesterday's legacy model that was invented with a very different set of assumptions than what the healthcare industry is today around the world. We are living through an industry that's beginning a massive cultural change. The changes that are important are not the ones that are in the U.S. Congress or in Parliament in the UK or elsewhere. They're the changes in the appetite and mindset that the public has. And people that are coming into the healthcare system today as new patients and new doctors, new nurses, expect the healthcare industry to be more transparent, to be more efficient, to be better at communicating what's happening, to not create errors. And so I think the role of government will be to accelerate the changes that the public wants as the public changes. And so, I'm very optimistic because I have a very clear read on how high the expectations are of younger people as they go through the system, and they don't believe they should settle for something less. So, yeah, I think it will take a while. It will be very disruptive, but it is inevitable.